Debo here. I'm Mr. Debo Strong, and this is Mrs. Debo Strong.
Hello.
You may have already seen some videos that we already posted, um, plumbing or leukemia related. We just want to give you a how it's all started video of how I got diagnosed with acute myeloid leukemia. Sounds rough. It is rough, but
Yep. Yeah.
we'll tell you how the story goes.
Yep. It started in New Year's of 2023. Mike had gotten sick with pneumonia and it wouldn't go away. It kept coming back
Yeah.
and going away, coming back and going away. Every couple of weeks, he was getting sicker and sicker, and fevers would come and he couldn't break the fevers. So, after urgent care visits and doctor visits, on May 23rd, Mike looked at me and said, "Hey, something's wrong. I gotta go to the ER. I feel it in my gut. Something's not right, babe. I'm gonna go to the doctor, go to the hospital and find out what's going on." So he went to the hospital. A few hours later, I got a phone call from Mike. He had said, "Hey, babe, I'm sorry. I have some bad news. They told me I have leukemia. The blood work came back. I have leukemia." And I mean, immediately, everything stops. And I'm like, what, huh? What do you mean? What do you mean? What do you mean? And the nurse had just walked back in the room to talk to him. So he had said, let me let you go. The nurse is here and we'll call you right back. And I said, okay. So, I mean, super quick. My parents live 5 minutes away. I called my mom, said, "Hey, I need you to stay as calm as possible, but I need you to get to my house and be with me because Mike just called from the hospital and he said he has leukemia." So my mom got to our house immediately. By the time she had gotten to the house, maybe 10 minutes had passed. Mike called me back and he was like, "Baby, you're going to talk to the nurse." And I said, "Okay." So the nurse got on the phone with me and she explained that. Pretty much in some words, she told me, "Mike," she said, "your husband is very sick. He has leukemia. We don't know what kind of leukemia. We don't know any of that. We just know blood work says leukemia. He is going downtown Detroit, baby."
Yeah.
Henry Ford saved his life.
Yeah.
We're sending him down via ambulance. They're putting him in the ambulance in just a moment. We've already called downtown. They have a room prep for him. They have a team of doctors already going through his testing.
Yep.
She said, "You need to get down there immediately." And I said, "Okay." So my my older brother came over and he drove me down to the hospital. Went to the hospital, went in and saw Mike. I'll spare you details. I'll give you a nice long post and give you all the details of what happened. But we found out that Mike had acute myeloid leukemia, and they immediately started him on hardcore chemotherapy, 24 hours a day for 7 days. They had told us there was a concern that he had mutations. It wasn't just acute myeloid leukemia, it was actual possible mutations. But we wouldn't know anything for a little bit, and the plan of care is not going to change. He needs his hardcore chemo regardless.
Right.
So we said, okay. A few days later, time went by, they came back. They said, "Listen, it's acute myeloid leukemia with multiple mutations. So that means you need a stem cell transplant to survive because your leukemia is very rare, it is very aggressive, and it's going to keep coming back at you." So
You need a stem cell transplant.
stem cell transplant, we need chemotherapy. So what we did is they did chemotherapy. They dropped him all the way down. And after he did his 7 days of chemotherapy, they turned around and they gave him a special chemotherapy medication pill that he had to take that was specifically designed to go after those mutations. After this whole process went down, we learned that Mike every few weeks was going to go back to the hospital for a few days and get chemo. And then he would come home. But he was going to do this continuously until they found him a donor, a perfect match to save his life. And
Thank you, Lord. Yeah. I know.
so
That's rough.
there was lots of ups and downs. He had COVID in there. We've got some other things that had happened. But regardless, he got a stem cell transplant. In October of 2023, they found a perfect match. He went back to the hospital, had a stem cell transplant. And they told him before they started, you are absolutely positive you are doing this stem cell transplant, because once we give you this chemotherapy, you will not survive it. You will have to get a stem cell transplant to survive and to live. So you have to be sure this is what you want, which obviously, yes, this is what we want. But, they have to ask those questions. They have to make sure you understand everything. Yeah, it's a grueling process. It's long. Fast forward, stem cell transplant went awesome. 100 days. We made it. He's made it past the year. He's doing great.
Yep, we're almost at 2 years now.
In May of this year, we'll get that'll be 2 years since he was diagnosed. Yep. But fast forward, he's doing great. He does have something called graft versus host disease, where he is
fighting.
His body is fighting, the donor, which medications, different tests, different things are helping out. Yep. That's why he's got some, skin changes, and his hair is still, it's starting to come back though.
Yep, slowly.
Obviously, all things we can deal with to keep him here with us. So he's doing that. He also has some lung damage. Recently, we found out he's got some lung damage possibly from the stem cell transplant. So, it's a long process. And this is the video where we wanted to give you guys the update and let you know he's doing great. His leukemia is in remission. He's doing awesome. We're fighting. He's strong.
Getting back.
Staying positive is so important.
Yes.
But we also have upcoming videos that we're going to do, because with him being in and out of the hospital so much, we learned a lot, and we have some things that we feel we could teach and pass on to other people and help them. Yeah, some tips and things, all that. And, it's just, he's doing great, and you have to stay positive. And
Yep. And I've been a plumber for over 20 years, so I'm going to have some how-to plumbing videos to help people out. So we'll see how it goes.
Yep.
Some funny videos.
Yep. So we wanted to make this video to let you guys know stuff, and like I said, I'll do a long post. I'll put all the information in there. It's difficult to talk about it when you're going through it. You really don't stop and think, like, can I do this? Do I have that? You don't. You have no choice. You fight. You go through the motions. You don't sit and cry it. And if you do, because I'm a crier, obviously, you sit, you cry, you let it out, and then you pick up and you move on and you fight the next battle and you go through the next process. And
I wouldn't be here without you.
Love you. So it's just, it's hard. Like I said, it's hard to sit and talk about it and go through it after sitting and reading about everything that we went through, the ups, the downs, all the scariness. It's overwhelming sometimes. So.
I'll show you how to get it done, though.
Yeah, absolutely. So like I said, I'll make you guys all a long post coming up here shortly. Let you all know what happened. We'll keep you updated on everything that he's going through. And if you guys need, positivity, and just let us know. We'll pray for you, and we'll help guide you if you have any questions or anything like that. We'll try to help if we can, but stay positive.
Yeah.
That's what
Come follow us along.
Yeah.
At Debo Strong. Debo's out.